Right. Hello, folks. Well, you will notice that I'm not with Tim today. Tim is on holiday, but I am joined by the dynamic duo of Kate and Jennie, who, as you've probably noticed, are twins and are very dynamic in the health coaching space in their two different sort of workplace settings, one from the legal sector and one from the health sector. So I thought it was a really interesting opportunity to talk to Kate and Jennie about their experiences of health coaching and our thoughts about how we might be able to bring this into workplaces and the challenges that we're facing at the moment. So who shall I start with first? Who's going to introduce themselves first? Kate's going to go first.
Yeah, so I'm a cost lawyer. I've worked in law for over 25 years now. I'm also trained and qualified health coach and a member of the UK IHCA. I am a non-practicing health coach at the moment. I'm still practicing in law, but I do see a lot of potential for health coaching as a wellbeing initiative to kind of properly address some of the problems that are happening. The crisis of wellbeing in the legal sector.
Okay, thanks, Kate. We'll
Yeah,
come back to that crisis in a second. But Jenny, why don't you introduce yourself as well?
yeah. So I'm a GP. I'm a GP. That's basically what I do. But also a qualified health coach and lifestyle medicine doctor. So, um, sorry, there's a dog in the background here.
Oh, there we go. We like dogs in there as well.
Yeah, me, Daisy. Then we'll give Daisy's opinions on health coaching in a bit. Um,
Yeah.
so yeah, basically, I'm a GP and qualified health coach, and I try and bring health coaching principles into my role as a GP and advocate for health coaching beyond the healthcare setting, really, to kind of, I suppose, support people's health and well-being where they are, rather than everything. What's the word? Kind of gravitating into the healthcare service. I think my perspective is the more people can be empowered with respect to their own health, where they're based when they're well, the less pressure there will be on the healthcare system, and the better health people can experience.
Yes, brilliant, lovely. So interesting. So both, it sounds like both of you are well trained and have the background, but maybe struggling a little to put it into action in your various settings. Do you want to say a little
Mm.
bit more about how you have managed to use it, or maybe what some of the blocks have been?
Um, if I go first, I mean, for me, I haven't formally health coached in my workplace. I have a wellbeing group, so I sort of try and feed some of the coaching principles and into it in terms of gathering information, really, which has actually been really beneficial. Gathering that time and space to be heard is so crucial, and some of the insights you get, small things, can make such a big difference if you can feed that back to leadership and they can implement these changes. It feeds out, it does have an impact on things like morale, engagement. So yeah, that's one of the ways I think the health coaching has informed, my approach to that.
Yeah.
Yeah.
And you mentioned, Kate, if I don't mind just circling back to it, there's a bit of a crisis of health and well-being in the legal sector. Are you happy to say a little bit more about that?
Yeah, I mean, there's so much research going on, academic research about the crisis of well-being in the legal sector because, I mean, it's very well documented. It's a high-pressure profession. It's very rewarding. It's intellectually challenging. It's a brilliant profession to work in, but on a personal level, there's pressure, there's stress. It can be relentless. So there is a crisis of well-being, and I think employers are keen to kind of address it. They want to find solutions, and it's difficult. And I'm not sure the data's quite there, to see what's most effective. And change takes time. Changing culture takes time. It's not just. I think that historically there's been a bit of a, here's an app, here's something you can do to help yourself, but it's not really enough. It's the more pressure on the individual to deal with it themselves when they're already dealing with things, which is getting stressed in the first place. So I think there needs to be kind of a top down and a bottom up approach to well-being. And I think health coaching fits really nicely in there because it's empowering the individual, it's giving them space to see what's most important to them and what they want to work on. But it's also the message you're sending from leadership and management. We care, genuinely care about you. This is space for you. We want to give you opportunity to address whatever your key health concerns are for the benefit, of your performance, but for the benefit of you as a person, which feeds into, ESG and wider social impacts, because that then has an effect on that person's family, their friends. So yeah, I think there's a real sort of role for health coaching.
Yeah,
It
lovely.
does affect, it does impact on how people show up, I think, because
Yeah.
when people are treated well, I think, when people are in a bit of a negative place, so if people are burning out, no one's going to function at their best, and they're not going to interact at their best with other people either.
Including clients.
Yes, including clients.
Yeah.
Um,
And or patients.
Yeah.
no, but it shows how the culture change, just treat the kind of humanizing approach, I think, recognizing human value, treating people as people and encouraging them to, dare I say, thrive. I think is actually a
Yeah.
useful strategy for all aspects of.
Well, I think of it, if I can just go to the sort of business side,
Mm.
risk is obviously a big
Mm.
issue in law and
Often.
many professions, of course. But risk, you're more likely to make mistakes or maybe not make the best decisions if you're not well, if you're not in a good space yourself. So in terms of risk management, really helping people to optimize their own health and well-being, I think is a big issue and a strategic priority to,
Yeah, it's
in all
really
professions.
Yeah, thanks, Kate. And Jenny, from your point of view, it's interesting, isn't it? Because here you are, you're a doctor, you're
Mm.
applying your health coaching skills perhaps with patients, but now we're talking about the workforce, aren't we, and our colleagues and
Mm.
I hear what you're saying there about sort of, if the workforce is well and healthy, actually it leads to less risk in the workplace and higher quality performance. So it's
Mm.
interesting, isn't it, thinking about how we look after each other. And do you see that, Jenny, in the sort of the general practice or NHS workforce as well? Do you see a similar sort of thing to Kate, that you worry about the well-being of the workforce?
Yeah, yeah. I mean, I think it's just it's all so kind of it's also fast paced, isn't it? It's also performance driven and target driven, and again, I keep going back to the kind of humanizing approach, but I think conditions, working conditions. I don't mean the environment, but the sort of the way that we work, the fast pace and the disconnection isn't really conducive with how human beings are well in themselves, or in terms of how giving you the space to even look after yourself, sort of self-care wise, it takes a back burner and it's kind of survival rather than thriving a lot of the time. And I mean, we did a little well-being thing at my workplace, didn't we, a while back, to be fair. And it was an opportunity to sort of get people together and, just talk about self-care and, feel a bit more connected and supported. But even in general practice, which is sort of community-based, I don't know what your practice is like, but you can you can be very disconnected, can't you, in your room, sort of fast-paced, patients back to back all day. And yeah, I think everyone's in their own rooms doing the same, and well-being is just it's not really. I don't think it's a high enough priority, to be honest. I think there's a lot of, like you said, things can be subtle changes. They don't have to be great big overhauls, but with kind of shared. What's the word? What's the word? Um, what's the word, Ollie?
Well, when
Shared kind of
sharing your problems or sharing your sort of your concerns and anxieties and vulnerabilities, that sort of thing.
well, yeah, all that, and shared
Insights.
I can't think of the word. Like if everyone's got the same idea and the same, if everyone's the same
Alignment.
Shared goals.
Alignment.
yeah, shared goals. That's
Yeah.
great, isn't it? From coach, what's the word?
Yes.
Goals. Yeah, shared vision, and kind of if people are wanting to make some changes, I think it's easier. But there's often resistance, isn't there? Because people are in doing mode, kind of getting through the day mode or getting through the week or the year. Um,
Yeah.
it's yeah, I think it's challenging, which is why I think culture and systemic change, but small scale to start with if necessary.
Going on from that, I do think health coaching provides space to, like, an opportunity to gather useful data anonymously and confidentially, of course. But like, I don't think it's when we did that one at your place. One of the issues people that were concerned about was predictability of work and what we were expecting.
Oh yeah, that was key actually. Yeah.
And then would that come out if you weren't having a discussion about well-being? I mean, you might just take it for granted. Like, I haven't got predictability, but if you start understanding what is bothering people and affecting their well-being, you put at least try and put things in place. Or sometimes just I get that's really tough when you haven't got predictability, and just that validation can make a difference. You know, that someone gets what your concerns are. So health coaching does create a space for for that, for the data and for the validation.
Yes. So you're sort of talking about how you can use it as a way of sort of improving the conditions of people generally, because
Yeah,
unfortunately we're not diving down deep enough into what it is that really makes people tick and what really matters
yeah,
most to them and so on. Um,
yeah,
so health coaching provides that sort of space and time to do that in a little bit more.
yeah.
Is it different from your sort of traditional, HR meeting or a kind of appraisal and that sort of thing? What is it that makes health coaching different then, do you think?
I think it's a safer space. I think people can be suspicious of HR. I know HR, it shouldn't be the case, but people can be. It's like, if it's going to get back to my boss if I tell this to HR. Whereas health coaching, I think, it's a confidential, safe space. It's about you and what matters to you. It's a bit detached, I suppose, from what else is going on in your work life, but also related.
It's very
So
person-centered, isn't it?
yeah, it's almost an ideal space to, gather these insights and an iterative approach, see what works, see what matters, implement something, get the feedback, see if it's made a difference to people's well-being, an ongoing process because it's never going to end. And it shouldn't. It should always evolve and improve.
So how do we make space for this then? And that's always in a world where we're so busy, time is so limited, isn't it? Resources are so limited. I mean, in the NHS, Jenny, how are we going to make space for this sort of well-being of the workforce then? Million
Good
dollar
question.
question.
I got
The
nothing.
million-dollar question.
Is it worth it?
Well, I don't know, but I know some practices are because I've sort of following what other practices do. Some they do just change the culture. They maybe um, change the 10-minute appointment model and have them different length appointments for different complexities, which does require more um, careful triaging, I suppose, into those slots and things. It's almost like a whole specialty in itself, isn't it? The kind of how to optimize the working day. But I mean, there's time, isn't there, when GP practices are closed for training,
Yeah.
and there's updates on sort of cancer referral pathways and local services and things like that, which are all very important. But maybe dedicating some time to that. That's more towards
And
sort of well-being.
how much do you think we're talking about, sort of in terms of having a health coaching conversation, let's say? You'd normally expect it to be
Oh,
one to one, would you? Traditionally that's probably how you'd see it, and what would it be? Would it be an hour, a week, a month? If you were planning it
oh,
yourself, what would you like to see?
oh, you mean in terms of health coaching of the workforce
Yeah,
in the
if
workplace?
you were offering health coaching to your colleagues or to each other, how could you see that working?
Mm. I mean, you could have protected time, couldn't you? Um, you could build that into the working week. Um,
And
in terms of how,
how often do you think that would need to be? I don't know, Kate, if you've got an idea on this, sort of any thoughts about how much
Mm.
time we'd need to make to allow health coaching to happen?
Well, I think it won't be one size fits all. I think it'll be different for different people, depending on what they're working on. And for one person, I think it'd be different throughout, their time at that firm.
Yeah,
But I think I would see, maybe an hour for the first session where you really get to understand, what makes them tick, where they're coming from, what the barriers are, and just learn, just get that insight to start with. And then
yeah,
I could see it just being 20 minutes, 20 minutes every couple of weeks to some accountability, more if they need it, if they want to see about something specific. But yeah, to just keep the conversation going, keeping the goals in mind, and just that ongoing support. I don't think it has to be massively time consuming.
yeah.
And yeah, I think there'll be peaks and troughs, but that's it. That's what you need. Like sometimes people do need more support, and yeah, it's a question of how to make it happen.
Yes. And the time is so restricted. And sorry, Jenny, you're going to say something there.
I was just going to say, it's looking upstream though, isn't it? Because yes, there's going to be some deliberate having to make time and build it into someone's working week. You know, whatever that looks like, whether it's 20 minutes, whether it's an hour a week. But then what's that going to look like in contrast further down the line if someone's not in a good place or they're burning out or even just their immune system's just, you know, they're just ill with a flu for a week because their health's not great. You know, that's a lot more time lost further down the line, plus the potential impact on, sort of your presenteeism, your concentration and everything in the run up to whatever illness is going to hit. So I think, upstream investment in well-being is a really insightful, obvious intervention.
Recruitment costs. If you end up with people leaving, it can cost a fortune. The lost productivity and the recruitment cost of having to find someone to replace them and train them up and get them up to speed.
If you can
we
find
often
someone.
we forget that, don't we? And I think there is emerging evidence, isn't there, that workplaces that do put some time, protected time, perhaps, Jenny, into making sure you're looked after, retain staff, don't they? And they don't have the turnover. And that that, Kate, don't you? That in your profession, recruiting and inducting people and getting them up to speed, it's a huge investment in that, right?
Yeah. You see, I think when we're talking about how do we find time, I think we need to not be thinking of health coaching as a well-being add-on. I think we need to be looking from above at a bird's eye view at the full picture. Same with the budget for well-being initiatives, because you can look, it's like, what are the costs of the presentees and what is it actually costing you in terms of time and money?
Yeah.
What are the costs of, disengagement, presenteeism? It's like, well, really, whatever that's costing you, if your meaningful wellbeing initiative, let's call it health coaching, is a fraction of that, then and you bring down that cost, then you're doing well. Whatever the separate wellbeing budget is, might be lower than what the health coaching is cost, but the health coaching might be saving you. So I think
lot more.
There needs to be a big picture. And in terms of time, what I would love to see in law is a designated, time code. We have time codes for all our time recording, call it reflection, some firms do have this sort of non-chargeable time recording codes, which I admire, or, call it personal development, because you're going to develop skills along the way, self-efficacy, you can build on it's your own growth. It might not be directly, related to your day-to-day work, but it's related to how you show up at work. So it's innovation, it's growth, it's personal development. It's not just even well-being in my mind.
Yeah, I love that idea that you could actually, in a profession where they put codes on all your time, you could actually put a deliberate code on this is your personal well-being, and
Yeah,
that
and growth.
that adds value, growth and
What
well-being.
message does that send as well? Like, what message does that send?
Yeah,
If you're going into performance review and it's not like what your billable hours, but it's brilliant to see you've spent this amount of time on your personal growth this month, on your well-being. Can you tell me how you've benefited from that?
yeah,
And then that feeds in. You see what people are gaining, what they appreciate, what they prioritize, and what matters to them. And then you can start a positive cycle of improvement and innovation. And what else can we do? What else can, to get the wheels going in the right direction instead of firefighting and reacting to stress and burnout.
It's that kind of positive, forward-thinking focus rather than swirling around, the troubleshooting, firefighting bit.
Yeah,
It's that kind of positive growth, innovation. Workplace evolution is what I like to think of.
And people
in a positive direction.
Like, we don't all spend every minute of our day. I mean, obviously I do. Just solidly working.
I do.
obviously we all do that. Yes, of course we do. Yes.
But people go and they have a chat over coffee, they'll talk to someone about the weekend. Let's not fool ourselves that everyone is constantly, every minute is productive. So, but why not just give someone half an hour a week for their well-being and personal growth, and then see what happens? Because I would predict, morale's going to go up, people are going to feel appreciated, they're going to really value the firm. They might even talk to people. Well, guess what I get at this firm? And then it's, it can attract talent and other people to the firm. It just creates positive cycles, lots of them, I
I
think.
think in terms of, because like you say, people talk,
Yeah.
people are going to like to share that positivity. And in terms of collaborations for organisations, I would expect that having that kind of clear demonstration of investment in human value is an appeal in terms of, choosing to work with one person, one company rather than choosing to work with another.
Like a selling point.
Yeah, selling point. Integrity, I think, is the word. Especially for the the legal sector, obviously, it's it matters. Yes, it matters.
Integrity, man. And do you think that you could just say, well, you can have half an hour to go for a walk at lunchtime, or sort of, do you think there's something about having the health coaching structure there that adds something additional to this, to more than just the time for yourself?
Well, it's an extra resource, isn't it? It's a valuable resource that you can use. I mean, fine, if someone would rather go for a walk and they don't feel they need health coaching, good to have the option of both. People can do whatever is right for them. But I mean, I've had coaching myself and I am a trained health coach. And I still found amazing the benefit. I felt transformed just having that space where this is all about me. I can just talk about what's going on for me. I know like realize things that hadn't even occurred to me. You sort of can break some patterns, you get insights.
I got insights by proxy from her insights from her coaching. So in terms of ripple effect, it extends beyond the coachee.
Yeah, it does. It really does.
Because it's a culture.
But having that space, especially when you work in a fast-paced kind of role and you're just always on the go and thinking, you don't always have to stop. You don't have time to stop to reflect on what could I be doing better, even when you know there's things you want to do and you know how to do them. It's like, but how? How am I going to make this? Like, sometimes you need that soundboard and someone to reflect back for it to make sense. Yeah, crystallize.
Yes, so I suppose that what you've got that human interaction, the human accountability, and you've got a little bit of structure, a little bit of sense of purpose and direction that a health coach brings. So that adds that little bit of kind of scaffolding, if you like, to that space and time. I think we all appreciate that, don't we?
Yeah.
Before we wrap up, there's one thing I want to just, and it's interesting with both of you because I guess doctors often worry about the legal consequences of things. And Jenny, you might also come in on this as well as around the sort of doctor-patient relationship. Do we think we worry that sometimes that health coaches will overstep the mark into an area that should just be doctor and patient? Is there a space here for non-medical people to be supporting people with health? I'm interested in both your views on that. Maybe, Kate, in your views legally, do we get in trouble here? And Jenny, you're a practicing GP. How do you feel about that?
Well, interestingly, we were at the IPM conference, as were you, and there was a talk, I forget who it was from, but it was a toolkit for well-being, for health and well-being. And it basically said, anyone can do this for anyone else. You've just got to care. So the crux of it was, yes, having some insights about different aspects of health, but it was the support of another person was key, and the two things combined. So with that, bearing that in mind, you wouldn't have to have any medical knowledge. So in the same way that, I don't think to be health coached, the health coach needs, because the person is the expert in their own health, so they're supporting that person in the context of their own health. So they don't need to know any more medical information than that person does, or even as much, because the person is the expert.
You're not worried. This is not overlapping with what a GP or a doctor or a nurse would do. This is a separate sort of thing.
I think yes. I think health coaching is not a medical, it's not a medical intervention. Again, I think that's why, to me, I think the huge potential, I think we definitely need them within the NHS. There's no doubt there, because they are part of, we need them as part of our sort of multidisciplinary teams. But we need them because the patients need them, people need them, to, like you said, to sort of scaffold the health and the well-being and the behaviours that are needed, and the health literacy, I suppose, a bit, the health awareness, but all these things around the people, wherever they are. So if that's in the workplace, that won't be part of a multidisciplinary medical team, so it won't be medicalised, it'll be health, but without the medical side, is my thinking.
Yes.
I think I see the concerns. I expect there are concerns that people will. I think sometimes it is perceived because of the word health, with poor health and management of that. But to me, health coaching is move in the direction of good health and health optimization from where the person's at. So it's not managing the medical complexities of it.
Yeah.
You're legally.
And with
Yeah.
your legal head, then, Kate, you're not worried that the health coaches are overstepping the mark here into the medical domain. This is a whole area that you can practice in the workplace without legal risk. Do you think?
Yeah, I can see why firms might feel nervous about the idea of a health coach because it seems like an intervention or some kind of therapy, which it isn't. It's coaching. It's providing that space. You're not really even you're not guided. That the person's doing the work themselves. You're just there to facilitate their goals and help them, aren't you? I think the important thing is to just everyone needs to know what the scope and remit of a health coach is and have a clear policy in place. It's not like it's a piece of work, but it's not going to be difficult to just have that in place. Before someone has some health coaching, here is the remit and scope. Health coaches have their own insurance anyway.
And the UKIHCA's got the scope of practice.
Yeah. So it's a fairly easy job to make everyone aware of what the scope and practice of a health coach is. I can see why firms might worry on some level that they're accepting some extra duty of care, for health because they're providing this. But really the contract is between health coach and the coachee, and it's not an intervention. It's not a therapy. What harm is going to come from that conversation?
Yeah.
Where there's no causation. There's no harm.
So as long as health coaches know their boundaries, you're saying know their scope, and of course, what I get sounds like what we're all saying as well. There's huge space here. There's huge potential.
Yeah.
You don't need to be a doctor. You don't need to be a nurse. You don't need to be a sort of therapist. But actually, what you're doing with health coaching is providing that human interaction and scaffolding and sort of sense of direction, sense of accountability, perhaps, and that adds a huge amount that's just not been there in the past, really.
Can I say one more thing?
Please, of course.
Like a lot of firms these days are on board with mental health first aiders, mental health champions. Like mental health, you could have someone in crisis and they're going to some employee of your firm to talk about their mental health. That could be a scary thought in terms of if you're worried about liability, that sort of thing. That's a big, kind of responsibility for that mental health first aider.
That's potentially an emergency, isn't it?
Yeah. So, and they'll signpost and things as necessary. Health coaches can signpost. They know where to signpost.
Yeah.
I see it as the similarities and parallels between health coaches and, in terms of what you're providing to employees as a resource. So I think if you've embraced mental health first aiders, mental health champions, why not embrace health coaches and look at the, holistic health, all aspects, because they are inextricably linked, aren't they? Mental health, physical health, you can't have one without the other. So let's provide support for both.
Love it.
Yeah.
So any sort of final comments on this then? If we were going to think about how we could take this forward, what would you like to see as the next steps, if you like? If we're thinking about workplace wellness and the potential for health coaching to be introduced, bearing in mind the worries about time, the worries about sort of accountability, can you think what would you like to see employers doing next?
I go.
Yeah.
What I'd like to see as a first step, I really think it's important to get the employee voice. Why not send out a survey, just see, explain a little bit about what a health coach is. Would you like to see, would you like this as a resource? Would you use it? Two simple questions, see if people want it. If they want it, why not just try it? A pilot, it doesn't have to be a huge commitment. Try it for 6 months, measure, measure the uptake, measure responses, get some qualitative data, what's it meant to you? Maybe try and gather some data about if it's impacted on presenteeism, absenteeism, and just see and take it from there. Try it because it wouldn't be that difficult to embed. I don't think. But you can train, as you know, Ollie, you can train someone up in 4 days. You can train an existing member of staff up in 4 days, get them rolling as a health coach. There'd be things to think about the time aspect and things, but it's not insurmountable. If you want it to happen, it can happen.
That's
I know
great.
and places are doing it. They could, if I mean, if people were sharing what they're doing,
Yeah.
and firms can learn from each other about what's working well. Like the culture. I don't know. I mean, I'm not in the legal sector. If there's a culture of sharing that kind of practice,
Share a health coach.
Well, there's a wellbeing conference
You
coming
could.
up.
Yeah. I don't see why you couldn't share. If you've got a group of firms that are affiliated, why you couldn't have a health coach. They share a health coach.
Oh, I didn't mean.
Oh,
Well,
what do you mean?
yeah, that would be good.
Oh,
Yeah.
you mean sharing what they're doing?
Sharing stuff, sharing stuff,
Oh, we
sharing.
could share a health coach.
You could share a health coach. You could share your learning. Yeah, and best
Yeah,
case.
share the learning.
Yeah. Any last comments from you then, Jenny, about thoughts
Oh
about
yeah, I do have one.
one?
Go back to what similar to what Kate's just said, and to what you said earlier about organisations. Basically the silo thing. I think when we talk about unlocking human value, human health, getting the most out of people for people's benefit and for the organisations. I think when we're looking at health in terms of mental well-being, women's health, emotional health, all these different things, I think to optimize them and remove the blind spots, we really need to bring them all together, because people are a complete whole, not their mental health here and their physical health over here, which isn't necessarily addressed this bit anyway. But I think the more we can appreciate the whole health aspect, the more we're going to be able to release and unlock human value for everyone's benefit. And I think, to me, health coaching, you need the culture that's on board. You need the opportunities like the time windows for the half-hour break and go outside, and options for nutrition and rest and hydration and all these things. But you need, I think, a health coach pieces it all together, scaffolds it around that person, and then they can progress. So that's my thoughts. Whole person.
Whole person. Lovely. Great.
Whole person.
Well, I really appreciate it. Thank you. You've just jumped on this and given us fantastic insights from two sort of contrasting but similar high pressure situations. So thank you. You're a tour de force, the two of you, and look forward to seeing how the two of you keep talking together and share ideas across professions. And let's see how things develop. Thank you very much, both of you, Kate.
Thank you.
Well, thank you.
Cheers.